On Tuesday, we told you about the dangers of ACL tears and who's most likely to suffer them.
And today, News Channel 18's Elizabeth Rentschler reports on the types of surgery available, and she takes us on an exclusive look inside the operating room during an ACL surgery. Elizabeth?
Jeff, Gina, thanks to surgeons at Lafayette Orthopedic Clinic, News Channel 18 was allowed inside the operating room during an ACL surgery. Now, this type of surgery is very common and only takes about an hour to complete, but it's a surgery often followed by months of rehab. Hearing this sound coming from the operating room might make some uneasy, but for orthopedic surgeon Dr. Robert Hagen, it's just another day at the office. On this day, he's repairing one of the most common injuries in sports, a torn anterior cruciate ligament, or ACL.
I do about 80 a year. I used to count, could tell you, but I don't count anymore. This may be my first field hockey ACL. Not a lot of field hockey played around here.
His patient is 17-year-old Weston Schwab, who tore his ACL playing floor hockey in gym class.
I was running with the ball and I don't know, I just kind of jumped and landed on it wrong and it popped out.
Schwab took a trip to see Dr. Hagen, who recommended surgery. Dr. Hagen says there are 3 main types of surgery you can have. He says you can take a tendon from a cadaver to repair the damage, or you can use a hamstring. Schwab is getting the most commonly used method, taking part of the patellar tendon, which rests between the kneecap and the shin bone.
You take a piece of bone from the kneecap, a piece of bone from the shin bone, and take a small strip of that tendon and use that.
That's it right there. That's a perfect picture of what happens. It's like taking a rope and shredding it into little strands. It's just not gonna provide any support for them.
The surgery takes about an hour depending on the amount of cartilage damage in the knee. Luckily for Schwab, he has none. However, his injury, which occurred in seconds, will result in months of rehab.
And they'll see the physical therapist for some more strengthening and conditioning for often 2 months afterwards. Most of those people, though, are doing very well at week 2 or 3, but it takes about 2 months till the knee feels good, and then it's probably 3 to 4 months till you can play sports, probably 6 to 8 months until you're playing real well.
Dr. Hagen says if patients take the rehab process seriously, they can perform just as well as before their ACL tear. In fact, one of his patients went on to score the winning goal for Japan in the World Cup against the United States last summer. Elizabeth Rentschler, News Channel 18.
And now